how with investment we can move to a better service more respectful of the patients we serve. Spending on mental health as a percentage of a country's spending on health exceeds 12% in most modern Western societies. One of the most unfortunate recommendations of Vision for Change was to limit spending in Ireland to 8.2%. However, even this would be an improvement on the 6.8% spent in 2008 and the paltry 5.4% being spent in 2010, and still falling. I must appeal to the government to stop the plunder of our mental health services. I believe in Minister John Maloney we have someone who is committed to our services. Regrettably, he seems hamstrung by a senior minister with no interest in our services, and a HSE which is run by managers who continue the habits of old and who siphon off monies from mental health and ID to other parts of the health service. The manager with responsibility for the mental health services, Martin Rogan, must be given a ring-fenced 8% budget of the total health spend at a minimum. Otherwise, he will merely become someone to be scapegoated in future in the face of future criticism. There was much credit claimed by government when monies for capital expenditure were committed in the budget. And I hope to see real evidence of this spend in mental health with real improvements in facilities for our patients. However, there is growing concern that spending committed for the building of new facilities in places like Beaumont Hospital are being pared back to a point where concern is growing on a daily basis that we will be given new but second-class facilities that will merely serve to embarrass our services into the future. I call on government to ensure that yes, we get good value for the taxpayer, but also good facilities for our patients. Traditionally in this country, the responsibility for the provision of services for the intellectually disabled was left to religious orders and other voluntary groups. As a result, the services that have emerged are poorly structured and disparate. In recent years, providers have been joined by groups supported by frustrated families. The Department of Health and Children has identified that the service is poorly structured, with far too many organisations, over 600, and far too many CEOs, accountants and other managers, and excessive duplication of staff and structures. A working party has been established to carry out a value for money audit and policy review of the disability services. We support the view that scarce financial resources must be focused on frontline services and not on duplicated managerial and support services. And this state's approach to the provision of services for the intellectually disabled is a disgrace and an international embarrassment. While we depend on voluntary groups, parents and friends and religious orders to provide the services, we find that the state is actually paying 97.5% of the cost of these services. But with over 600 providers, there is, as I've said, a great deal of duplication of managers and back office staff. At the same time, we know there are shortages of frontline staff and extensive waiting lists. I want to welcome the current review, but we must see movement towards integration and amalgamation as soon as possible, with significant rationalisation of duplicated services. One warning: savings achieved must be reinvested in frontline services and not poured down the Anglo-Irish drain. It is little short of astonishing that if an intellectually disabled person is nursed in a mental health facility, his living conditions are inspected annually. However, if he lives in a HSE or a private or voluntary institution outside the influence of the Mental Health Act, then this institution is not inspected. And information received from HICWA indicates that under the Health Act, a commencement order must be issued from the department in order to proceed. A regulatory impact assessment must take place to assess the level of provision of stroke resources required to achieve the standards. And secondly, HICWA have been in touch with the department regarding the requirement for them to have additional resources, for example, to pay inspectors to carry out the inspections. There has been no progress on this most essential and promised development. Today in this hall, there's a nurse who phoned HICWA to complain about the services to his patients. He was told to find another job. That's fact. At the end of a conversation, he was told, we can't do anything for you, and if you're that frustrated, the alternative is to find another job. So even if a nurse phones HICWA and declares concerns about their HSE service, they will be told there's nothing HICWA can do. This is unacceptable. Services for the intellectually disabled are also suffering in these times of financial constraint. They must be subject to inspection, public audit and reporting. In recent weeks, the Irish Human Rights Commission was very critical of the John Paul Brother Charity Services in Galway. Well, all I can say is, if they were critical of the John Paul services, I fear to think what to say of the HSE services. It would be appalling. But the response of the acting CEO, Miss Garrity, was to warn that the current HSE cutbacks would make existing services unsafe. She probably meant unsafer. We have previously called for inspections for all services for the intellectually disabled. We now said to government that this is both essential and urgent and must not be long-fingered. If the working group on congregated settings that has residents housing 10 or more residents or clients is due to report soon. In this preliminary work, the group have expressed concern that over 4,000 persons, most of them with intellectual disability, are living in such settings. It is recognised most clients have a high degree of dependency, often with complex needs. And the initial work recognises the low level of staffing across the services, with consequent severe limitations on activity for those clients. The evidence is depressing, but not surprising to those of us who are familiar with those services. When compared to international best practice, our services are an embarrassment. However, our government must recognise that the cost of correcting this situation will be great. More staff will be required, just like in City is today, where the modern Knockaman Centre remains unopened because we cannot get approval for the extra 50 nurses required to run that service. Colleagues, when the report on congregated settings is concluded, I think we will require a one-day conference of our ID nurses. As a society, we have lost respect for authority. We have lost regard for financial institutions and for government. And we have recently seen a campaign which attacks psychiatric medicine. I have suggested elsewhere that we might intern psychiatrists, or perhaps send them all away on a long holiday. And then what? Will those campaigners be happy? What then of patients in crisis, the hypomanic, the paranoid, and the dangerously deluded, and the depressed and suicide? Talking therapies will not penetrate their illness. Is it not unreasonable to suggest that in that situation we would end up seeking asylums to incarcerate people as we've done in centuries past? When I posed this challenge at a recent meeting with service users in Dáil Éireann, I did not hear much in response. Unfortunately, much mental illness in its acute form is not nice. In fact, it can be frightening. Thankfully, we have psychiatrists and nurses and others who have developed their science and practice over the years, whose knowledge of the effects of ECT, of psychopharmacology, and of psychological therapies is enhanced, who adopt an eclectic approach, who coalesce with other paramedical grades in pursuit of the best interests of patient outcomes. Yet the anger of many service users is palpable. They are angry that they were incarcerated. They are angry about where they were incarcerated. They are angry that the service in which they were treated was not well resourced and modernised. Colleagues, they are right to be angry, and they are right to express it. They are not right to blame it all on clinicians and nurses. However, we have much to learn from service users. We must be open to their criticisms. We must seek to learn from their experiences. What made them better, what didn't? Nurse training must seek to provide graduates with the skills appropriate to respond to the needs of patients, as defined by those patients. We are trained to understand how some mental illnesses pervert reason, twist and confuse perception and thinking. We understand that some drugs are not pleasant, and ECT carries significant side effects. However, we also understand that drugs for physical medicine are often unpleasant, and that surgery is in fact barbaric.